Hello, everybody. I'd just like to welcome you to our Thursday community call. Again, this call is being recorded, and I appreciate you taking the time to listen in on some of the valuable information that we have. My name is Jeff Jelnick. I am the Incident Commander for the Public Health Department's COVID-19 response. So with that being said, we will turn it over to Jesse Phelan for some valuable information.
Hi everyone, just a few updates for you from last week. The first thing we want to touch on is just a reminder that the gold standard for quarantine when you have been exposed to a COVID positive person is 14 full days in quarantine. There are some CDC guidelines out there which we have presented here on the screen that talk about two alternatives, but again, the gold standard and best practice is truly to be quarantined from other people for 14 full days, as we have seen some folks test positive in those last 4 days of quarantine. So it's just, again, best practice and referred to as the gold standard by CDC, DHS, and the Sauk County Health Department. So moving on to lab timeliness, that is getting a little bit better this week, although that is always subject to change based on volume at the lab. We are seeing some better turnaround time. We will soon be changing our shipping process, which should further cut down on that time that it takes to get results back as well. There will be some dates changing with holidays coming up, so please, as you can see the link on the screen there, please refer to our website and our testing site locator for the changes in the schedule. There are a couple of differences with holidays coming up to be aware of. Then just reminding who should be tested. Obviously, folks with any COVID-like symptoms, again, those can be found on our website if you're not familiar, and people who've had close contact with someone who tested positive for COVID-19. And then again, people who are just regularly in touch with other folks. Maybe you work in a grocery store or a restaurant where you have frequent contact with different people. So those are all good ideas for testing as far as that goes. And again, free testing sites in Sauk County, you just head to our data hub and look at the testing site locator. That will give you that information. And then I just briefly wanted to touch on vaccination, COVID vaccine updates. They are starting to trickle into Wisconsin for what they're calling phase 1A, and that includes our frontline healthcare workers and EMS and long-term care residents and staff. So we're starting to see that come into Wisconsin, and we'll see more of that as the next number of weeks go on. The vaccine that has arrived is the Pfizer vaccine. Moderna is being reviewed this week by the FDA for emergency use authorization, and hopefully we'll see approval for that as well. I did want to talk just briefly about this type of vaccine. It is a new type of vaccine in that the vaccines that we're used to seeing are not this technology. This technology has been being worked on by scientists for a number of years now, but this is the first one to market in this setting. So the mRNA vaccine, which stands for messenger RNA, this quote I'm going to give you is from Dr. Tom Frieden. He was the former director of the CDC for many years and has a background in epidemiology, public health, and infectious disease. And I like this because I think it breaks it down and makes it very simple to understand. An mRNA vaccine does not actually contain the virus itself. Think of it more as an email sent to your immune system that shows what the virus looks like, instructions to kill it, and then, like a Snapchat message, it disappears. We're very excited that this vaccine is here, and hopefully this will be the light at the end of the tunnel we've all been waiting for. I believe that's it for me. I think I'm passing it over to Jody.
Okay, great. Thank you very much, Jesse. My name is Jody Molitor. I'm the Emergency Preparedness Coordinator, and I have also been the Planning Section Chief for our COVID-19 response. So the impact that we're seeing from COVID-19 continues to affect our lives every day. As we head into the holiday season, we urge you to follow good public health practices this holiday season. We stress that it is safest to celebrate upcoming holidays with the people in your immediate household and not risk gathering with others. Traveling, hosting guests indoors, and sharing food, utensils, and plates all pose significant risks. Now is the time to be persistent with following our recommendations. Every act of prevention that you can do matters, and it will continue to be important to all of us this holiday season. There's still a large amount of community transmission in every area of our region and state. So we ask you to keep your gatherings small and to wear a mask anytime you're in an indoor environment with someone that you don't live with. Our healthcare and our public health workers continue to need your help in slowing the spread so that our hospitals can continue to meet patient needs. We urge you again to stay home, take precautions to stay safe if you must leave your home, and we encourage our businesses to take additional steps to protect their customers, employees, and our community. Just some reminders of everyday practices that you yourself can do to stop the spread. Physically distance at least 6 feet from people with whom you do not live. Wear a cloth face mask unless you're unable to wear one for medical reasons. Wash your hands frequently. Remember to not gather indoor with people outside of your household. And if you are able to gather outdoors, limit your gatherings to 10 people or fewer, physically distance, and wear face coverings. It can be difficult to suggest changing our holiday traditions, which we do understand. So please remember that safer celebrations offer protection for the most vulnerable members of your family, so you all can gather together in years to come. Please remember, we all did a really great job over the Thanksgiving holidays, and that is why we did not see the spike that we were worried about. So we again encourage you to do the same for this Christmas and New Year's holidays. Stay separate and celebrate those holidays virtually if we are able to. Thank you.
Okay, we're going to move back over to Jeff with some additional updates for us.
Alrighty. Just a couple things here on dates. This community call is scheduled now for December 24th and December 31st, and those are Christmas Eve, New Year's Eve. So we are going to give the health department staff a well-deserved break. So we will not be having community calls on December 24th or the 31st. We will be going back then on starting January 7th. Our wellness webinar, hopefully folks took advantage of that. We are going to be doing that again here on December 29th at 6 p.m. Not sure right now what the topic is, but as soon as we get that, we will be getting that out on our Nixle system as well as on our county website. So it will be December 29th at 6 p.m. Just not sure right now what the exact topic is going to be. And then just a reminder that the county building, the West Square building, remains closed at this time. It's open to the public by appointment only. If there's a committee meeting or a public meeting, the doors will be open so that you can come in for the desired meeting. Courthouse remains open. Reedsburg Human Services is also locked, but open to the public by appointment again. So I would just encourage everybody to call the department that you're looking to talk to ahead of time so that when you get here, they know you're coming, you've got an appointment, and it doesn't create any delay in getting your things done that need to be completed. So the other thing I would just like to highlight real quick is just what Jody was saying. I just want to thank everybody for taking and utilizing the public health guidance. We did not see the spike that we were worried about, that the state was worried about, and I think is the nation as a whole. And I truly believe by following this public health guidance again during this Christmas holiday will be so important to getting to that light at the end of the tunnel that Jesse talked about with our vaccination and finally getting COVID defeated. So thank you for doing that. We appreciate that.
Thank you very much, Jeff, for those updates. And next, we're going to move on to the data update of our COVID-19 trends in Sauk County. So for those of you that don't know me, I'm Siobhan Allen. I am the Quality Improvement Coordinator with the Health Department. And during COVID, I have become the Data and Informatics person. So we will go ahead, give me a minute here to swap my screens to swap over to the Data Hub. Okay, you should be able to view the Data Hub now on your screen. So a couple of things to remember about the Data Hub. It is best viewed on a computer. Some of the charts and graphs don't display properly on a smartphone. And also a lot of the charts and graphs do take a while to load, so please be patient with it. A couple other links on the Data Hub that are helpful. If you look up at the top here, there is a link to the testing maps for updated testing sites in Sauk County. So check back to this page, especially over the holidays, as some of the regular dates for the testing sites have changed to accommodate those holidays. Okay, so we will start with an update. So this information is current as of Thursday, December 17th. Our cumulative case count is now at 4,129. Our doubling time is now 44 days, which is great. The last time that our doubling time was in the 40s was in mid-October. So we have returned back to about that same doubling time frame there. There are 59 new confirmed cases to report today. This is a bit of a jump from the past few days, and it brings our 7-day average number of cases per day to 27 for the past week. Some of this jump was due to a lag in lab testing time and getting those results in. There are also today 37 new recovered cases, which brings our current number of active cases in Sauk County today to 370. Next, for our hospitalizations, we do have another hospitalization to report today, bringing the total number of Sauk County residents that have ever been hospitalized due to COVID to 147. When we look at our recent hospitalizations, our new hospitalizations are declining. So in November, we were averaging about 2 people hospitalized a day for COVID. And in December, it's just over 1 new hospitalization a day. And also on the Data Hub, if you scroll down a little bit, we do have the current number of COVID inpatients and also the COVID patients in the ICU. So you can click these charts to see the number of COVID patients that are being treated in Sauk County hospitals. So this is not necessarily the same as the number of Sauk County residents ever hospitalized, just because a Sauk County resident with COVID could be hospitalized outside of Sauk County, and also somebody that is not a resident of Sauk County could be hospitalized in a Sauk County hospital. So these numbers don't necessarily mean that it's a Sauk County resident being hospitalized in a Sauk County hospital, but it does give you, an idea of some of the hospitalizations and some of that trending over time. Unfortunately, we do have another new death to report today, bringing the total number of Sauk County residents that have lost their lives to this virus to 24. So you can see that our deaths really did increase throughout November and December, and we averaged 1 death just over every 3 days throughout the time period of November and December. That's unfortunately kind of stayed pretty consistent when we look at the past 2 months. So you can also see the deaths over time on this chart as well. If you want additional information on the cases, so additional demographic information on the cases, those hospitalized and those who unfortunately have lost their lives to this virus, you can scroll down to the demographics section. Sometimes the Data Hub does this. If you see that, just close it out and click refresh. And usually that reloads those charts. So let's make sure that that is working again. Okay, so the case demographic data is in this section here. Give it a second to load. The ages of the confirmed cases gets updated Monday through Friday. The ages of those hospitalized gets updated usually Wednesday evening, sometimes Thursday mornings. So you can see that most of those that are hospitalized are age 60 and over, although there are some younger individuals that have been hospitalized for COVID. And then you can also see the ages of those who have lost their lives to this virus. Other information that we provide in this section is also the severity of our COVID cases. So about 4% of our cases are what we classify as severe. So these are the individuals that are hospitalized or that ultimately lose their lives to this virus. So that's about 4% of our total cases. About 36% of our cases are moderate. So these are cases that seek medical attention and receive outpatient care for their symptoms. We have about 53% that are mild. So these are people that experience symptoms but are able to recover at home without any medical attention. And about 7% of our cases are asymptomatic and do not report any symptoms. This number is decreasing. So over the summer, we saw that this number was about 16-17%. So now it's down to 7%. And I think that some of that is a decrease in testing. So we are not catching a lot of these asymptomatic cases anymore like we were in the summer. Other information that is also provided on the Data Hub is the race and ethnicity of our cases and of those hospitalized. And we can see that our Hispanic and our American Indian residents are unfortunately overrepresented in cases and in hospitalizations when we compare those percentages to their overall Sauk County population. So you can see this information on the Data Hub as well. So next, let's take a look at our surveillance data. And we did have a couple more metrics move from the red to the yellow, which is really encouraging to see. So we'll run through these pretty quick here for you. So the first chart that is on the Data Hub, this one does take a while to load. This is the State Disease Activity Dashboard. And you can here on this particular map, under Select Area, select Sauk County, and then it will display for you Sauk County's information. So our case activity level is still in the very high activity level. It is down from the critically high that it was in mid-November, but we are still in that very high case activity level. Our percent positive is in the medium, so this we consider to be in the yellow. So our percent positivity for the second week in a row is in this area. Our COVID-like illness activity, this metric is the number of individuals that go to our Sauk County emergency departments for COVID-like symptoms. So that unfortunately is still high, but our influenza-like activity is low. A lot of the COVID precautions also do help stop the spread of flu. So it's good to see that as well. So those are those 4 metrics, and you can click on the activity indicator here to see more information about any of those. So you can see the percent positivity and how that has changed over time as well. If you scroll down, you can see more information. The state percent positivity map does the 7-day percent positivity. We also do calculate it out over 14 days so that we're comparing similar time frames for all of our metrics. So when we look at our 14-day percent positivity, it's 7.9. When we scroll down, we'll actually scroll down to our tests conducted. So this measure has consistently been in the green because we do a high level of testing in Sauk County. So our kind of baseline is set at 48 tests a day, and we do well over that. However, in the past 14 days, we've averaged 417 tests a day. And when we compare that back to the month of November, in the month of November, we were averaging 510 tests a day. So in December, we're doing considerably less testing than we were in November. And some of that we think is because of the increase in lab time. So hopefully with the work that we've been doing to kind of decrease the amount of time it takes to get lab results back, that will continue to encourage people to get tested. So again, if you have even one symptom, if you have been exposed or if you think you have been exposed, please go get tested. There's a link at the top of the Data Hub here to get to the COVID testing sites in Sauk County. Our lab reporting is improving, our timeliness of lab reporting. So this was in the low 40s through the past couple of weeks. So this jumping up to 64% is really encouraging. So at 64% of our positive test results were received by the health department within 48 hours of that test being collected. The next one that's really nice to see move from the red to the yellow is our timeliness of disease investigation metric. So in early November, we were simply unable to conduct disease investigation interviews for every single person who tested positive. And so Sauk County prioritized those that were tested at our community testing sites. And if you were tested then at a healthcare facility, your healthcare provider was the one that called you with your test results. Well, with the recent decrease in new cases per day, we've been able to conduct more disease investigation interviews, and we actually moved then from the red to the yellow as we were able to conduct disease investigation interviews within 24 hours of test results for 77% of new cases in the past 14 days. So that's great, because when we're able to do a disease investigation interview, we're able to make sure that we're notifying people of their results, that we're able to support them in isolating and able to support them in contacting their close contacts so that we can get better control of the spread of this virus. So it's very exciting that this has moved to the yellow. And then the other metric that moved to the yellow that is pretty exciting as well is the community spread. So this has been in the red over 30% for a very long time. So seeing this move to the yellow with 27% of our cases that we were able to complete interviews for that were not linked to a known source case, this is really good news for us, that we're able to connect where people got COVID from. So it is really encouraging for us to see this metric move from the red to the yellow. So I really hope that this continues to be this way, because this is another sign that we're able to get better control of the spread of this virus. A couple other common charts to look at on the Data Hub. So we'll go back up here to the new cases by date confirmed. We'll talk again about the little green line. So you can see how this has continued to decrease in the month of December. However, we are still above this very high case burden. So this goes back to what we discussed earlier in this call and holiday safety precautions and how to celebrate the holidays safely. If we want to keep this line moving down after the holidays, we need to continue to take all of those precautions seriously. So, we did not see a after Thanksgiving holiday spike like we were very concerned about. And I believe that that is because of all of the people that did take every precaution possible and taking the guidance seriously. So please continue to do that through these upcoming winter holidays so that we can keep this line moving down, and hopefully we can get it below this very high case burden line, and even better than that, get it below this line here. So we really want to be below 5 new cases a day. So if we can do that, we can get a lot better control of this virus. We can prevent people from getting sick. We can prevent them from being hospitalized, and ultimately we can save lives. So please continue to take all of the precautions seriously and celebrate the holidays safely with your immediate family. And there are resources on our website on how to celebrate the holidays safely. So we'll put some links into the description for this video as well. And as always, if you have any questions about COVID-19, COVID data, anything like that, if you have questions that you would like included in an upcoming one of these videos, please email them to covid19@saukcountywi.gov. Thank you for watching, and I hope that you have a safe and happy holiday season. Thank you.